but Dr. John has been working with the medicinal cannabis industry since the legalisation of cannabis for medicinal use in Australia in February 2016. As an avid organic farmer and permaculture expert, treatment with a natural whole plant products in conjunction with conventional medical treatment has always been a top personal priority for Dr. Tay. This talk is about Plantmed. Dr. Tay will share Plantmed's experience over the last 7 years and how patient treatment outcomes have improved. So please take away Dr. John Tay.
Hey, thank you very much, everybody. Thanks for coming down to this sunny corner to have a chat. And I think I'll make it a bit of a chat, really, because no one wants to be lectured to, and I can talk all day about whatever you like. But let me first introduce myself. So my name's John, Dr. Tay, and I've been in the medical cannabis space since we're allowed to, back at the end of 2016. And at that time, I wasn't into cannabis medicine at all. I was into cannabis and appreciated the plant and was, obviously Googling everything I could find to learn about it. But then one day in 2016, a lovely friend of our family named Nikki gave my wife a call, and she was a 21-year-old girl at the time. And literally on her 21st birthday, she got diagnosed with a type of brain cancer called glioblastoma, multiform, number 4. And that is a really, really aggressive form of brain cancer. And she didn't know what to do. She was 21 years old, and instead of celebrating her birthday, she ended up in Townsville Base Hospital and getting some brain surgery. And then she came to us and didn't know where to go. And so we came to Nimbin the first time because there was nowhere else to go. Cannabis was illegal at the time completely, not medically illegal in any way. And but when someone's close to you is going to die, you'll help them. And I think everyone who is a human will do that, whether it be their friend or family. And so that started me on my journey in cannabis medicine. And unfortunately, Nikki did pass away, but she had a lot better time on the way to her passing. She was a lot more accepting of her passing. She was pain-free for the majority of her time until right at the end. And then when she checked out, it left me with an important mission to keep going. And I probably wouldn't be here if it wasn't for Nikki. And even now, it makes me quite emotional thinking about her. So since then, I started out as a single practitioner doctor. My phone number got out there somehow, and I actually rang my dad a lot because he was a doctor, but he's retired now. And when you look up the yellow pages, you don't get me, you get him. We did in those days. And so he was getting a lot of phone calls from people looking for medical cannabis, and he'd say, "I think you've got the wrong person there." That's probably my son. And so I'm happy to be doing medicine now. At the start I wasn't, but now I've found my place in medicine, and that is cannabis medicine. So where can I start? I mean, there's so many great stories. I think just generally in our clinic at Plantmed, it's in Brisbane, and we can talk to you anywhere in Australia. We have great success rates, and I'd probably say, I don't know, I haven't done the stats, but I'd say 85% positive results, which for any sort of medical clinic is outstanding.
What's a
Positive result is so when someone gets improvement, someone in their own eyes a positive result, so they get relief of their pain, or they get relief from their insomnia, or whatever it may be. And we treat everyone and anyone there. Anyone who needs that medical assistance with cannabis will help. So definitely the mainstay of things we do will be just pain. And pain comes from where? Everywhere. Okay, you can have pain because you have got an arthritic knee. You can have pain from bowel disease. You can have pain from cancer. You can have pain, mental pain. But you can have lots of sorts of pain. And that's definitely a mainstay of treatment. And that's pretty simple. Cannabis works for pain. It turns down the pain at the level of the spine and changes the way you perceive pain and makes it bearable again. So people often describe that as, you know, they can not be distracted from just doing their life, from brushing their teeth, from brushing their hair, from getting changed. They can function again. And I think returning function is a really big thing for people. Another major area is anxiety, and we live in this world of anxiety right now, don't we? You know, it's been bred into us and it's forced down our neck every day on the telly. The last couple of years we've been scared into our homes through fear campaigns that have left the world anxious. And anxiety is fear, isn't it? And it's only alleviated when we get rid of whatever's causing that fear, or we can adjust the way we respond to that fear. So anxiety is another major area where cannabis works, and without really any side effects in this case. You know, CBD is the mainstay of treatment for anxiety. Some people great benefit from THC, but really I start with CBD, and a full spectrum CBD, meaning there's a little bit of THC and other cannabinoids in there. And anxiety is a thing that goes along with all other medical conditions, you know. Chronic disease itself is anxiety. I have anxiety because I've got hepatitis or liver disease, and I'm worried about how I'm going to go forward, where I'm going to go, what happens if my liver stops. You know, so just having a disease can cause anxiety, and dealing with the medical system can cause anxiety too. You know, you go into the medical system and you go into this big hospital, say you've got cancer, and you enter one door and then it's this big building, and you get sent to one room to be scanned, another room to have your blood sucked, and another room to talk to the doctor, who's only a young doctor, who's only got 10 minutes to see you. Then you flick along to the nurse and you come back in a few months to outpatients. And you can get lost in this cycle, and it can cause anxiety itself. So one of my big jobs is integrating people's health and helping them deal with that healthcare system, and often deciphering the messages they're given. What's another big area? Another big area that we've seen great results in is cancer. And it's a little bit of a controversial area in Australia when we're dealing in the medical system. Because if I was to write an application, and it's easy to get your applications now, okay, so I'll just tell you one thing. The only prerequisite you need to have if you want to get medicinally legalised cannabis in Australia is to have had some sort of health condition which you've tried some sort of medication for and it hasn't worked, or you haven't tolerated it. That's the only rule the government has. So if you've got headaches and you've tried Panadol and it didn't work, or you don't like Panadol because it made you feel funny in the belly, that's enough, okay? If you've had sleep and you've tried a Mesindol or a Valium for your sleep and it hasn't worked, well, that's enough too. But cancer is a funny area, because in Australia I'm allowed to treat people for cancer symptomatically, right? So I can treat you for your pain, I can treat you for your sleep issues, I can treat you for your nausea associated with the chemo they're giving you, and the vomiting goes along with that. But technically, I'm not allowed to treat for a cure of cancer, because I don't have a cure of cancer. I can't provide the government with any papers that say, hey, if I give this person 100 milligrams of cannabis every day, they'll get better so much % of the time. Those studies don't exist yet. There are a lot of studies happening, and maybe one day we'll be able to do that. But at the moment, if we're treating with a curative intent, I call it remission intent, for cannabis, we actually have to say we're treating this person for the symptoms of cannabis. It's the same medicine that we use for symptoms as we use for curative intent or remission intent. We just increase the dose. So I'm happy to do that. I do that all the time for people. But a lot of doctors are uncomfortable to do that because of our political system, and with their not having a good knowledge of cannabis and worrying about how they're going to feed their families, you know, because the powers that be can come down hard on doctors if they don't toe the line, as it were. But we can certainly get cannabis medicine to everyone who wants it in Australia if they want it, and I think that's a big step forward in itself. Back in 2016 when Nikki came to me, and I started practicing as soon as you could, so at the end of 2016 to early 2017, and in those days we had probably a selection of 2 companies to buy medicine from, and they had a selection of 2 oils and a flower each. It was that hard, and to put in the application would take 2 or 3 hours just to sort of fill it out on paper, had to be on paper, and then fax it in or post it in, and then get your approval back in 2-3 months maybe. And that's not quick enough for someone who's sick, obviously. That's all sped up now, so that's not an issue anymore. We can get your approvals through within 28 hours, or if we use our authorised prescriber, as a lot of doctors have, you can just prescribe the medicine straight up. So, treating people for cancer is something which I do, and I've seen good results. Okay, I've seen what works best in cancer. I think that I've seen is probably breast cancer. Breast cancer seems really amenable to treatment. I've had more than a handful of patients that have had complete remissions from their breast cancer. So they would have had a node, or it has some spread of that cancer. They might have had their breast removed, and they're coming perhaps with that curative intent, because I will do that for people, or perhaps they just want symptomatic relief, in which case we can still do that as well. And when I treat people for cancer, we take that dosing a lot higher. So we might dose, say, I don't know, 10 to 20 to 30 milligrams a day of CBD and THC, just for a basic thing like sleep or anxiety or mild pain. But when we're treating for cancer with that intent, I actually follow something called the Brick-Simpson's protocol, or something similar, which is basically high-dose cannabinoid therapy. I match that with cutting out carbohydrates and sugars out of the diet, and then a little range of supplements, or a big range, depending on how excited you get, of things that will boost your endocannabinoid system. So the endocannabinoid system is something that everyone in this tent has. We've always had it since we were born, since we were conceived. Actually, before we were conceived, it's involved with implanting of those eggs and sperm joined together into the uterus. The endocannabinoid system directs that from there, all the way through your growth. As you become a child, it directs your growth. As you become an adult, it directs your stability through life, and as you come to dying, it starts to direct you towards death. And everything in between birth to death, our endocannabinoid system is helping us get along. It's helping us deal with the stresses of life, and that's what its job is. Its job is balance, right? In our body, like our aircon, we have I like to set my aircon at 23 degrees, because it's not too hot, it's just right for me. I like that temperature. And our body similarly has a thermostat, but for everything in our body. So from how we go to sleep and when we wake up, how our inflammatory system works, how we deal with chronic pain, how our guts move, how our eggs move in our ovaries and get ready to be sent down to have a baby in your uterus through the fallopian tubes. All of these things and more are controlled by the endocannabinoid system. And really briefly, what happens is we have a stress. Okay, so what will the stress be? I've got an arthritic knee, right? I've worn this knee out because I was in the army, did a lot of hiking, and now I've got arthritis in my knees. So our body's intelligent. So we'll express cannabinoid receptors around that knee, especially around the inflammatory parts, so the white blood cells and the lymph cells and all the things that are coming to deal with that inflammation. And also the pain component, so the chronic pain that comes from there. Normally what happens is when you have chronic pain, eventually your body works out, hey, I don't need to worry about this because it's not going to kill me. I want to get on with it, and we'll turn it down. But sometimes when we have chronic pain, that turn down knob is broken or not working properly in our bodies. So cannabis will help us turn on that pain off switch, as it were. So keeping that balance is something that happens all day, every day. If you have, say, temporal lobe epilepsy, in your brain, in the areas of that temporal lobe, you'll have way more cannabis 1 receptors, which are the ones that are associated with your nerves and your neurons in your brain, and they're found in high density throughout your brain and spinal cord. You'll also have an excess of cannabis 2 receptors, and they're the ones in the brain and throughout our bodies that deals with pain, it deals with inflammation and immune response. So we're wanting to turn down that inflammation in your brain, and we want to turn down that electrical signal. But no matter how many of these cannabinoid receptors we might put out, if we don't have anything to stimulate them, they're not going to work, okay? And part of the problem with a lot of our diseases is because we haven't had cannabis in our lives, because we haven't got it in our bodies every day, because we've stopped eating it, and we've stopped smoking it, and we've stopped ingesting it as a medicine, we're relying on what we make in our bodies only. And the other problem with our world at the moment is that we don't have enough of those things that makes our body healthy and gives us enough endocannabinoid building blocks. So we need omega-3 oils, and we're very deficit of those in Australia and in the West. So we should have plenty of these omega-3s oils in our bodies, and we get them from eating oily fish. If you're an Eskimo, you're usually all right. But what happens is those good fats, and they also come out of hemp seed oil, okay? So drink lots of hemp seed oil. Fill your body up with either the fish oils or the hemp seed oils, because they will go into every cell membrane of your body and swap out with the fats that are already there. Then, when you need cannabinoids or you need a cannabis receptor, the really cool thing about cannabis is it's on demand. And we don't really know exactly why and how the cannabis receptors are expressed, but they're expressed in areas of need. And we know that when they're expressed, how they work. So having enough of these good fats in our bodies means we can make enough of our own cannabinoid receptors, and we can have the right fats in there to make our own cannabinoids. Anandamide and 2-AG are the name of those, on demand, and they'll be made locally, in this case near the part of the brain that's having trouble. They'll then flow into those synapses, connect with those receptors, and then turn down an electrical signal, okay? So we can extrapolate that to everything, that same thing. So when I deal with a lot of children as well, and children's a funny area because the government really doesn't like children to take cannabis because they're very conservative and they prefer that they didn't. Basically, that's the flat rule of it. But a lot of kids get great benefit from cannabis, and I, because I'm willing to, I think is the main reason. I have a lot of kids on my books, and I treat them from debilitating anxiety that goes with ASD, and the ADHD, and obsessive compulsive disorder, even the Tourette's and the tics. As they say, 1 in 4 kids these days is classified as being on the ASD spectrum. 1 in 4, 25% of the population. Not so long ago, that was 1 in 10,000. So when we look back to 1970.
So what happened?
What happened? Yeah, that's a good question. Well, there is a really funny graph that correlates the amount of glyphosate. So that's a Roundup or a type of herbicide which we use on all of our crops. And since about the 70s, we've just started dumping that glyphosate all over the place. Kills the weeds, gives the wheat or whatever we're growing more weight. Okay, it makes it easier to grow. And if you graph the tonnage of glyphosate and you graph the incidence of autism spectrum disorder, it's got a very, very funny correlation. In fact, it's exactly the same graph. So this is really interesting, and there's a pathway that is shut down by glyphosate. It's called the Shikimate pathway, named after the scientists that found it or discovered it. And that will kill the plants that they're trying to kill the weeds off. What it also kills is your gut bacteria. And gut bacteria are really important in mental health and in gut health. They prevent damage to your gut, and they prevent and when it gets damaged, the gut will actually get leaky and let in inflammatory stuff into your body that shouldn't get there. It literally goes between the cells. They should be tight junctions. They're not so tight anymore when they can't be protected by good gut health and good probiotics. So there's definitely a correlation between that and probably the nutrition that goes along with that. So if you are eating a lot of these Roundup-laden foods, and that's why I love Nimbin, because this is a community that really understands this, and you've always got the options for clean food here. So, but if you don't understand or even think about that, and you just feed your kid the standard stuff, and you feed it the infant formula, and you don't breastfeed it, breastfeeding is another really important thing in terms of the endocannabinoid system, because in the breast milk is very high levels of endocannabinoids from the mother, as well as other forms of immunity, and you pass that along to the kid. It's also really, endocannabinoid system is also really important in oxytocin, and that's your hug drug and the one associated with mother-child bonding. So I think it's a combination of all those things. I think it's a combination of poor nutrition, since birth, chemical interference in the form of these herbicides and pesticides, and a lack of cannabinoids in the body and a lack of ability to make your own. So with ASD in particular, we do know that there's a lower than normal circulating level of these endocannabinoids. In fact, there's a thing called the endocannabinoid deficiency. And it's not a syndrome or it's not a disease, it's something that one of the leading American cannabis doctors, Dr. Ethan Russo, he's the guy that invented the first commercial cannabis product called Sativex. Very good doctor, very good at cannabis, and he noticed there was a group of diseases that seemed to all have one thing in common, and that was lower than level circulating endocannabinoids. That group of diseases includes things like eating disorders, inflammatory bowel disease, migraine, fibromyalgia, a whole bunch of basically inflammatory diseases that are very common in our world. And that's what I think about when I treat people in the clinic. I don't look at them and think, hey, just have some THC and CBD and go away. I say, hey, you're a human, you've got an endocannabinoid system, and in fact your endocannabinoid system is specific to you, okay? It's like your fingerprint. And I've got this whole bunch of medicines here from the plant, and what's the best way I can match up your system, your needs as a whole, and the plant medicine, and how do I deal with the other things you're already taking? Are you taking another 12 medications, or are you taking none? And then blending those things together. And all I'm really doing is trying to maximise people's endocannabinoid system. One way you can do that, of course, is by taking cannabis, CBD and THC, and the other components that go really with those two components. So one big thing I hate, and I'm happy to take questions at any time too, okay? Just shove your hand up and we'll answer any questions you got. One thing I really hate is isolated cannabinoids. I don't hate the cannabinoids. I hate the fact that someone's bothered to isolate them. You know, this plant grows in the sun, it'll grow without hardly any attention. Of course you can grow much better cannabis if you pay a lot of attention. And when you grow cannabis, it has THC and CBD in varying amounts. And we've really pushed that towards high THC in prohibition because people wanted to get high and stoned. So they want more THC. And so the market has met that. But if you take CBD or THC out of that plant mix, and instead of taking all the bits, then you're missing out on the entourage effect. And if anyone was in the hall before, we had a brief touch on this. But there's a lot of stuff in cannabis that works in our bodies medically. So you've got your THC and CBD, they're big ones for sure. But then you've got over 144 minor cannabinoids, cannabigerol, cannabichromine, lots and lots of different types of minor cannabinoids, and they all have their own particular small effects. Similarly, you've got over 400 so far extracted terpenes, and these terpenes are really important as well. They give cannabis their nice aromas and tastes. So when you smell a nice bud or flower, you're not really smelling the THC and CBD, they don't really have a smell, you're smelling the terpenes. And in fact, you talk to any experienced cannabis user from either side, from the medical or the recreational side, and they'll say it's all about that smell, it's all about the terps, or it's all about the terpenes, and they're the thing that makes a quality cannabis. So it's not all about the highest THC percentage you can get, but also what else is in there. And all those components work together. They work together as a team. The whole is greater than the sum of the parts. So you need a lot more CBD and THC that's isolated, and it generally doesn't work as well. In fact, I find that isolated CBDs don't even work for anxiety generally. You know, I think it's more placebo most of the time. Hey, if your anxiety's gone, that's fine. Yes, question.
No, I think it's the entourage effect.
Yeah, that is the entourage effect, that's right, yeah, that's right. So, as I'm saying, when you have an isolated one, you don't get the entourage effect, there's nothing to work with. So I use the entourage effect, and you can use it yourself to cheat a bit. And here's a great tip for anyone who is a recreational smoker out there. If you have a mango, half an hour before you have a smoke, you're going to fill your body up with myrcene. Myrcene is found in your heavier indica strains of cannabis, and they're the ones that give you that really relaxed couch lock sort of feeling. So if you want to get more of that feeling, you have a mango before you have your cannabis, you have your THC, your indica. Similarly, I'll use that in the clinic with one of my favourite essential oils is called the Pike oil. And that's the reason I love that oil is because it's got about 50% pure beta-caryophyllene. And caryophyllene is one of those terpenes which is found also in black pepper. And it targets the cannabis 2 receptor. It's got a higher affinity for the cannabis 2 receptor. They're the ones which are associated with your inflammatory response. And when you add that one in, you're going to reduce inflammation throughout your body, you're going to reduce pain throughout your body. And that's my little girl over there, and I rub it on her gums when she's teething. And 8 to 10 minutes later, I can guarantee you that crying will stop. So one drop on the gums and she feels better. One drop once or twice a day, you'll feel better if you've got those pain elements, or if you've got other inflammatory issues. So great for inflammatory gut disease. Great for your mental health too, because with all mental health, we have inflammation in the brain, and we want to turn that inflammation down. So epilepsy, ASD, anything to do with the brain, if it's an illness, there's increased inflammation in your brain. And that's one of the big things that cannabis is doing. It's pulling back that inflammation in our bodies. It's getting that inflammation thermostat and making sure we're trying to hit that low inflammation target. Then you don't age, right? Inflammation is aging. Yes?
For women, since we live in a horrible world and not everyone access organic food, even if you get organic food, you're going to help depleted the soil is. And we have so many issues with hormones. What would you suggest to get? See, it's very confusing because you see a naturopath, they give you all the tincture that is all in alcohol, or you go to a doctor who does bioidentical tests and give you a tablet. So, what would you suggest?
Exactly. That is a really very relevant question. So what this lovely lady was saying is we live in this world that's full of chemicals which act like hormones. And one of the big problems is they're called phytoestrogens and also plastic-based estrogens. So phytoestrogens are plant forms of estrogens, and soya beans are a big source of phytoestrogens, for instance. And similarly, we have plastic-based estrogens, so chemicals which come from plastic like BPA. Everyone's heard of BPA, so there's a BPA-free plastic bottle. The reason we want BPA-free is because those chemicals also act like estrogens in our bodies. So having too much estrogen in your body is a big problem because it usually is secreted in really small amounts. And that helps regulate, as a woman and a man, regulation metabolism, but more importantly for women. So now we have a lot of people come into the clinic which have diseases like endometriosis or fibroids or really heavy periods and that sort of thing. So these phytoestrogens and plastic estrogens are a big component to that. They're a big contributor to that. So the best thing to do is avoid them. And then, like I was saying, that is hard to do. One thing is to avoid plastics. The other thing is to avoid the phytoestrogens and estrogen-mimicking chemicals which are also in pesticides and herbicides, so eating, as you say, organic or clean food or food that you know has been grown well. And that isn't always an easy thing to do in this world. That is hard, but it's something which, if you're really interested in your health and you're really interested in your longevity and having a healthy, long life, then you should avoid all these chemicals, especially, so avoiding all your plastics. Don't heat stuff in plastic. It makes me cringe when I see staff at work, and I'll actually tap them on the shoulder and say, hey, there's bowls there, you can use one of them if you want. You know, it's a ceramic bowl, put it in that and then put it in the microwave. But you know, you see people heat up things in plastic, especially if it's got cling wrap over the top, and they heat it up and you look at it melting and dripping into the food. That is a really, really good way to give yourself these problems. Estrogens, high estrogens especially, are associated with a lot of women's reproductive cancers, breast cancers especially. So, you know, if you have got breast cancer, one of the treatments, if it's estrogen receptor positive, is estrogen blockers, which cause menopause. Essentially, they stop your estrogen getting secreted. So yeah, it's a tricky one, but it's about not putting in those bad things into your body. Where does cannabis come into it? Well, obviously, you know, you want clean cannabis as well. You want cannabis that's grown well. But cannabis is helping to regulate all of our systems. That includes your endocrine system. That includes your thyroid and your breast and your hormonal systems that are associated with your period, menstruation, fertility, menopause, etc. So there's a lot of work looking into cannabinoids and fertility at the moment, and how they may be very useful for treating people with female diseases. And I certainly have a lot of patients in the clinic who have endometriosis and breast cancer, and we see improvements in those people as well. So I think the main thing is not to ingest the products where you can, and be as clean as you can, but it is difficult. So does anyone else have any other questions? No? Yes?
Exercise, I incorporated into, I got colitis, so it's cannabis.
Yeah.
But I can't
Hold on a second. Can I give you the microphone?
So we're talking about exercise and cannabis?
No, I was just going to question, because I use exercise as part of my health treatment, because doing exercise produces anandamide.
Correct.
So it's a natural, cheap medicine, anti-inflammatory. You just got to expand and contract those muscles a few times a day, and you get another value.
That's right, yeah. Exercise and that endorphin rush that runners get and love, the runner's high, makes you want to do exercise more because you feel good. That endorphin rush is actually intimately linked with your endocannabinoid release as well, and your anandamide release. So the endorphin or enkephalin system is your opiate system in your body, so it gives you that little relaxed high after you've been running. And that system is just, you can't even separate it from the endocannabinoid system. So a lot of the drugs that we actually use in our world today, real basic ones. I think my favourite example of this is Panadol, paracetamol. So you have a Panadol, and people think, everyone has Panadol. Who's had a Panadol here? Everyone, right? And you have a Panadol and you think, hey, I feel a bit better, but why is that? Well, paracetamol doesn't actually have an effect on its own in your body. It gets metabolised by your liver to a secondary metabolite. It's something paracetamol. But that secondary metabolite actually works as an endocannabinoid. And then it goes and does the same sort of function as THC does, and turns down that pain signal in various areas, but one of the important areas is in the spine, like we do with cannabis, to turn down that pain signalling. And lots of things work as endocannabinoids in our bodies. You can actually get small amounts of anandamide in coca. So if you have a 70-80% coca, you're going to get a little bit of anandamide in there. That's why people love chocolate. One of the reasons, probably the sugar you put in there as well. But one of the big ones that I think is really important is those omega fats, and I'll swing back to that. It's all about diet and nutrition in these bodies. It's just a machine, or it's not more than a machine, but in the essence, it's a machine, and we have to have got the right components for it. So there's some studies which show that omega-3 oils themselves act as endocannabinoids. So they will stimulate your cannabis receptors. And this makes a lot of sense to me, and it got me thinking about it. And I thought, well, hey, before we had access to all this easy food, before life was so easy, so go back 300 years ago, we'll go back 1,000 years ago. We were hunter-gatherers in those earlier days as humans. Our bodies are still the same. We haven't changed much. And in those days, you might kill a crocodile or something big and you might feast, right? Or a turtle if you're Aboriginal, and you'll feast on that turtle. You'll eat every bit. The whole tribe will eat that whole bit. And then for a while after that, your body is full of those good fats, of those omegas that we're looking for, because that's wild game meats is a great place to get those fats. And those fats are the building blocks of everything in our body. So they're the building blocks of steroids. They are our cell membranes. They're the building blocks of our cannabinoids and our cannabis receptors. And a really interesting thing, and it depends how you interpret these studies, they're just done on animals, right? So they're not mainstream and not done on... There's something which most people don't consider, but another one of this group of studies says that when you supplement with these omega oils, you have a decrease in anandamide levels, and that's true. And that made me start thinking. I'm like, wait there, I'm telling people I'm telling these people they need to take their omega-3 so that they got more anandamide, right? Wait there, have I been telling them something wrong? No, I haven't been. This is my own little theory that I've put together on this one, but I believe that when we're in that fed state, we're in that feasting state, and those omega-3s are acting as endocannabinoids, well, of course we're going to have less anandamide because we don't need to make as much of it because we're getting stimulated already in our cannabis system, and we've got the building blocks to do whatever we want. So when we're in that fed state, that's when we heal, that's when we grow, that's when we can make the changes our body's requesting of us. If we're starving, if you're a vegan, and nothing against vegans, but if you're a vegan, it's really hard to get the right levels of these fats in your bodies. You can do it, you know, but it's a lot harder. But if you haven't got enough of these levels of these fats in your bodies, well, you're going to use whatever you have to make your anandamide to try and stimulate whatever all the receptors that are showing. So you're going to have higher levels than when you're fed. So it's this fast and fed cycle that we've always been doing as humans. And so if we make sure we're fed, we make sure we can maximise our growth and we can maximise our body's requirements and what we want to do. Question? Yeah, go.
Oh, sorry, I have one more.
Oh, sorry,
I'm also a medicinal user, but I'm curious, are you talking about using stuff like the omega-3s and cocoa and even the papaya essential oil in combination or in conjunction with the medicinal cannabis to enhance or get that, was it the entourage effect?
Correct, yeah. So
they'll stimulate other releases?
Correct. So you take your cannabis medicine, excellent, okay? And we're going to then, if you've got THC involved in it, we're going to be stimulating those cannabinoid receptors. If you've got CBD involved in it, we're going to be especially upregulating the cannabis 2 receptors, making them have more strength or affinity. So that's one way of boosting your endocannabinoid system, and that's certainly going to help. That's our most direct way of doing it. That's why I'm even talking to you, right? If it didn't have that effect, I'd have nothing to talk about. So that's definitely a place to start. But to maximise your effect, to minimise the amount of extra cannabinoids you need to put into your body, well, you want to maximise your own. So the omega-3s is one great place to start at maximising your own production. Adding in things which are, have endocannabinoid enhancing effects, like your cocoa, like your copaiba oil. Echinacea is another one that boosts natural endocannabinoid levels, and a lot of people use echinacea when they have a cold, and it makes you get well quicker. So supporting the endocannabinoid system gives you more effect at your meds, means you use less, means you're going to get closer to that regulation point. As we age, we can't reach those 100% function like we were when we were 6. When you're a little person, if you've got enough nutrition, your endocannabinoid system's at 100%. You don't need cannabis, you don't need any of that, because it's working perfectly, all right, as long as you've got the nutrition. But as we get older and we miss out on some of that nutrition, you can't always get back to the starting line. You're not always going to get back to the physique you had when you were 25, all right? We start to age. And what I want to help people do, and what I think is important, is to slow down that aging. We're not going to stop it, but we can turn it down, and if we give ourselves the right components, we can do that. Another really important area of that is your gut health. Okay, so eating your sauerkraut, eating your kefir, having a course of probiotics every now and then. Gut health is so important about the inflammation component, which we've talked about before. So when it's poor, you've got a leaky gut. Literally, you've got a leaky gut. But when it's good, those bacteria are breaking down the food into the bits that we need to make our neurotransmitters. Okay, so important for mental health. They're protecting the gut against damage and leakiness. But also, supplementing with probiotics and that sort of thing has been shown to boost your own endocannabinoid levels and endocannabinoid function. So, gut health is easy. It's fibre. So we use slippery elm at our clinic. A good source of probiotics. So naturally fermented stuff. You go to the Nimbin markets on a Wednesday. They've got amazing ferments and mixtures there you can buy. Well, you just get some of those ones out of the fridge at the pharmacy. The ones out of the fridge are important because they're alive. Okay, they're a live culture. And then combine those 3 things regularly together in your diet, and you'll get good gut health, and you'll get all these benefits I'm talking about. So it's definitely all the things. Yeah. I might take this lady first. Come back. Yeah.
How much omega-3 do we take one? And how about hydrogen peroxide? Because I was reading a book saying that to oxygenate, because some of the supplement you take, because again, depending on what you can afford. If you go to chemist warehouse, there's a whole range how effective they are, and this author said it's oxygenating your blood with H2O2. What do you think of that?
Yeah, so I think it's something which I've tried myself. Hydrogen peroxide, I think it made me feel better in really, really low doses. It has to be quite dilute. I won't talk around that because I just don't know enough, so I don't want to give people wrong information. But in terms of how much of these omega oils, I usually say 4 capsules a day of the fish oil to patients. Like take 3 or 4 a day, because what happens is it accumulates in your body anyway. So you don't pee out fish oils again. They go in and they start swapping with every cell membrane in your body until you're a fish, essentially. So they swap in and they stay there, and then they're in your stores to use. So if you're using the fish oils, I usually say about 4 capsules a day regularly, but it's about regular use. Similarly with your other vegetable sources, so flaxseed oil is a great source, as is hemp seed oil or hemp seeds are great sources of these plant-based omegas. And actually the hemp seed oil is a perfect ratio. But if you're using that hemp seed oil, it's what's called a short chain fatty acid, and we want to make a long chain fatty acid. So fish oils are long chain fatty acids. So if you're going to use the plant versions, you have to have a bit more volume. I usually say 3 or 4 tablespoons a day. Sounds like a lot of oil, right? But you can put it in a smoothie. You don't cook with the hemp seed oil, you have it raw. Put it in a smoothie, put it on your rice, put it on anything, put it on salads. But it's about that regular intake, and then you'll start to accumulate that as omegas in your cells as well.
What about coconut oil?
Coconut oil is different. It's a medium chain triglyceride. It's a very healthy oil, but it's not going to be doing exactly what I'm talking about here. Yeah, but it's also used, coconut oil is used a lot in the cannabis oils that I can prescribe medically because it's got that median, it's easily converted to what's called a medium chain triglyceride, and they're more shelf stable, they have good absorption in the body. They're the 2 main reasons we use them. I think in terms of dilution oils, cannabis, CBD and THC are fat soluble. So if you have other things you can do to improve your uptake of your oils, oral oils, is have them with a small amount, something oily, so like yogurt or cheese or a fatty meal. Similarly, if you have your oils with a big glass of water, they're going to make a pool of water with little dots of oil in it that have trouble getting into your body, so it's going to slow down your absorption. So good oils are important, and although we haven't got the luxury of exactly choosing what's in every formulation, I think it's important that we have good oils in the medicinal cannabis oils as well. Obviously hemp seed oil is a great choice, but it does go rancid, or it goes off a bit quicker, so people don't like to use that. Sesame oil is actually meant to have really good absorption capabilities, as is emu oil. So emu oil is actually thought to have very, very good absorption capabilities. And I know there's an illicit product that still uses emu oil because of that, and it's a very efficient product. So I'm kind of around the two sides of the wall, or the fence we can see through now, and I'm aware of the illicit market, and I've got great respect for it actually, and I've got great respect for the people like yourselves here who are brave enough to come out and look after their own health. Right, I'm going to go out, I'm going to learn about this stuff, I'm going to go and get it, I'm going to go and use it on myself and prove to myself that it works, and therefore prove it to the rest of my family and community. But for some people, they're not as brave as everyone here today, and that's where, certainly Plantmed comes into it. My clinic, the majority of patients are cannabis naive, meaning they haven't smoked cannabis or used cannabis before, and that's just a numbers game, isn't it? The majority of people in Australia are that way as well, and often this part of our community needs a bit of help, a bit of a holding hand, a bit of guidance, and I think even really experienced recreational people in the illicit market can do with some guidance as well if it's the health outcome they're looking for. Another question at the back?
I just, since I moved here, I tried some of the brews from the market, the ferment, and they made such a big difference. I thought I had it nailed with cannabis and my health, and then I tried the ferments, and like you mentioned, they made a very big difference to my health.
Oh, 100%. Yeah, I really recommend getting into fermented foods. And the best way is, is to have a go yourself. Sauerkraut's actually pretty easy. It's easy to buy as well. Kefir milk's another culture. So you just mix things up, you let them sit, and you do it in a clean way, and then you have a fermented food. And all those fermented foods are really rich in the probiotic bacteria. So putting them into your diet regularly is so important. I agree, and I'm a big fan of ferment myself, and recommend everyone get into it where they can. What else can I tell you about it? No, please shout out questions because it just gives me something to talk about. Question?
How does chia seed stack up?
Chia seeds are actually a really good source of omega-3 as well. Yeah, so adding chia seed puddings, all that, it's a really well-known high source of omegas, similar to your hemp seeds. So it's a volume thing with these things. You want to get a lot of the volume in for these base products, Yes.
So, just going back to anxiety and mental health.
Anxiety and mental health.
When you talk about it as a way to approach, I just wonder whether you would approach other therapists.
Yeah. I mean, it depends on the person, and what they've already got in place. So some people just come on their own volition, and they don't have a GP, and they don't have anyone else working with them, and then I'll just help them out. If someone has got a team of people working with them, a good naturopath is priceless. I've got a doctor. Well, I suppose not technically a doctor, but I call him Dr. Greg, and he's my naturopath, and I look up to him immensely. I feel like just a patient when I go and see him, and I think it's so important to look after all those components. So, there's lots of herbs and things that are useful for anxiety, and nutrition is really useful for anxiety. We keep getting back to nutrition, don't we? One of the biggest things for anxiety, and I hate to say it again, but it's the omega-3s, right? One thing with baby brain, everyone's heard of that, where, you have a baby and you always forget stuff, and go on after you've had the baby and while you're breastfeeding, go for a long time, especially during pregnancy, and that can lead to post-pregnancy psychosis even, or paranoid states. And that's literally because the baby is sucking those omega-3s out of your brain. You're so generous to that baby, you give it life, you give it love, hopefully, and you give it food and shelter, and you'll give it your own brain. You literally give it your own brain, and that's baby brain, okay? So nutrition is so important. They're talking in naturopaths. I've got a funny saying, and I hope no one's a naturopath here, but I call them, there's this group of patients which I call starving naturopaths. And they'll come in, they're a very skinny 28 to 40-year-old woman, potentially a vegan, on a very good set of strange esoteric herbs, but probably missing out the basics, being food, okay? And so treat your body so it can work well. Treat your brain so it can function well. So that's a really important thing to take into consideration. With anxiety, most definitely the mainstay of treatment from a cannabis medicine point of view is your CBD, a full spectrum CBD. And often that's all you need. So I start my standard dosing of CBD at about 30 milligrams twice a day. And that's usually enough to cover your recreational cannabis use, so you don't get the giddy-ups or the anxiety or a bit paranoid. Okay, it's usually enough to balance out whatever sort of THC you're going to be using generally. But if you're an anxiety patient, I'll boost that up stepwise fashion. And I might go 3 times a day, because the half-life of CBD is approximately 10 hours. So if you dose twice a day, you've pretty much got the whole day covered. But if you dose 3 times a day, you certainly have got the whole day covered. So I'll dose twice or 3 times a day with a good oil. 30 to 50 milligrams each dose. And usually 50 milligrams 3 times a day is enough for most people. I'll get to that question in a second. Let's talk about anxiety for a sec. And then you look at the other factors. Do they have sleep issues? What are their sleep issues? If you're not sleeping because your brain's racing before bed, often CBD will do the trick because it's about slowing down that racing thought pattern. But if you're not sleeping for other reasons, not the brain, well then THC is important. So treating sleep is a really big issue. A lot of people who are anxious don't sleep very much either, and they're often depressed at the same time. So getting a good night's sleep is important. And usually adding in THC, an average oral dose for sleep for an adult will be somewhere between 10 to 15 milligrams. It may be a lot less or maybe a bit more per night orally. So I'll use that and a matching amount of CBD. Okay? Some people will have what are called panic attacks, and if you have panic attacks, it's like this sudden onset of fear and doom, and you really don't know what's triggered you off. But you get really freaked out, your heart pumps, your breathing goes faster, and in those situations, some people get great results from just standard recreational cannabis, high THC cannabis. If that's the situation, great, you can use that. But often, if you're an anxious person, any significant amount of THC can trigger your anxiety more. So I'll give those people maybe a CBD dominant vaporizer pen that they can keep in their handbag. And I'll teach them a great breathing technique. If you notice yourself panicking, think about how you breathe. You pant, okay? So you breathe out quicker than you breathe in. I'm panicking, I'm freaking right out. And your body knows that, and it's a physiological indicator to your body. Quick, release some more adrenaline, release some more cortisol. I've got to get the hell out of here because that lion's going to eat me. So what I say to these anxiety patients is, hey, if you feel that anxiety starting to build, if you've got that panic attack coming at you, take your pen, go find yourself a quiet space in a park or in the smoking area if you're in a big building or a shopping centre, and have some inhales on that pen, however many, you'll work that out, 2 or 3, whatever you need. But really important is the breathing technique there, okay? So I make sure that they have a shorter in-breath and a longer out-breath. It doesn't matter really the proportion, the slower the better, but a shorter in-breath and a longer out-breath, it's the reverse of panting, it's the reverse of panicking, and it's taking that time out, but it's also a physiological trick to help calm you down as well. And some people might also like the THC component, but it still makes them a bit anxious, and that's also common in an anxiety patient. And that's where you make sure that in the inhaled cannabis you've got enough CBD. So if you've just got a straight THC, nice flower, then you can add a little bit of CBD flower in, mix it in there. You can also now, as we're moving more into a balanced way of thinking about cannabis, you can get balanced flowers. You can get flowers which have significant amounts of CBD in them, and they'll be less anxiety forming for people as well. So thinking about each person case to case. A big thing with our cannabis now is that it's really bloody strong, okay? We can get cannabis above 30% THC. And when you grow cannabis, I'm not a grower, but the process of the cannabinoids growing in the plant and changing in the plant, they start out as grandmother cannabinoid, CBG cannabigerol. And that's the first cannabinoid. And then there's a cascade, and I'm not 100% on the cascade, but that cascade goes all the way down to THC. So depending on when you pick your plant, you can change the CBD THC content. And the other big thing with this is that when you've pushed for a high THC plant, that's at the expense of CBD, at the expense of other cannabinoids, and often maybe at the expense of your terpenes as well. So when you've got a really strong THC, you can't have the CBD content. So to get a strong balanced flower, it's quite difficult. You can get like 10 to 12 to 14% maybe of each at a maximum, or you can have all of that as a THC, as a 30% THC, but you're not going to get both. Similarly, you can get a very high strength CBD flower. So people in the green market, so I call this market the green market, are used to a good flower often, like the feeling of cannabis, and that's no problem with that, to like what your medicine's fine. But if they're having that anxiety, they're not going to be happy with that milder flower. In those situations, I recommend mixing in a CBD flower with the high strength flower, so they're getting the feeling they want, but they're also getting the anxiety relief they want. So it slightly changes how the medicine works. Yes,
Okay, Dr. John, we have time for one more question.
Sure, does anyone have one final?
Yes, this gentleman here.
Perfect.
Oh, thank you for your talk today. It's been very informative. I understand that certain seed oils are good when they're not cooked. Which ones are okay? I've actually been starting to use ghee now.
For frying?
But for seed oils, is coconut oil okay for cooking with?
Yeah, so you're talking about smoke points essentially, and what happens when those oils are heated, they change their chemical properties. So in actual fact, ghee or lard is probably your best frying oil. It may not be the best for your cholesterol, but it's certainly your best frying oil in terms of smoke point and not forming bad compounds as they oxidise. So they're definitely your best. Things like you always say, don't heat hemp seed oil, don't heat olive oil. Well, you can heat them, and they're not necessarily going to be extremely bad for you, but you are going to lose those omega-3 qualities in particular that I'm talking about with the hemp seed oil. And the olive oil, similarly, you're not going to get those good qualities out of the olive oil when it's heated. So the smoke point is lower, and they burn and oxidise more easily. So you can look up the smoke point of most oils, and that will give you an idea of its heat sensitivity, ability to resist damage when they're heated. So certainly you're on the right track there with your animal, your ghee, clarified butter and lard, certainly the best things to fry in. And oils to avoid are they're bad to fry in as well. So your polyunsaturated oils, and your monounsaturated oils that are grown in a mass way. So I'm talking about sunflower oil, canola oil, mixed vegetable cooking oils. They're not only all contaminated with these herbicides and pesticides we're talking about, but they're actually boosting the bad oils. So we do want an amount of omega-6, but we don't want the omega-6 amount to be higher than our omega-3. We want really a ratio of 3 to 1 if we can get it. And those vegetable oils, canola oil, sunflower oil, avoid them like the plague. When you heat them, they turn into bad trans fats as well. Margarine is a bad trans fat as well. So avoid those vegetable oils, just don't even put them in your body. They're the things which are going to be contributing to your atherosclerosis and your hardening of your arteries and all that sort of thing. So, yes, it's hard to recommend a diet because everyone's individual, but a lot of people would get great benefit from what's called a keto diet, and that's where you would be using, ingesting a lot of these oils without heating them, and then also using a lot of animal fats as oils as well. All right, well, thanks so much. I didn't think anyone was going to turn up out here because when I turned up it was all hot and sunny, but thank you all so much for coming down and having a chat. I've got a few cards and flyers if anyone wants to contact the Plantmed and the Australian Cannabis Summit. There's a lot of great information to look at, and enjoy the rest of the festival.